Hey everybody, Dr. Bryton here with Two Tip Tuesday. Today we're going to kind of further progress on the idea of what a cavity or decay is. Mostly, for those of you who are wondering, what do you do when decay or a cavity is found? So we talked about in the last few weeks how decay forms through acid, through sugar. We talked about what happens essentially in the mouth with regards to the breakdown of enamel and how we can prevent that. With fluoride through your toothpaste, a prescription gel, mouth rinses, varnishes at your cleanings. Some of those that need maybe even fluoride tabs that don't have fluoride in their water. And then we talked about proper care through your at-home care, through flossing, brushing twice a day, again using rinses, and then making it to those advanced hygiene therapy appointments, those oral wellness visits, and making sure that you have a hygienist or a professional clean your teeth. So what happens if cavity or decay is found? There's three main things that we can do to fix the tooth with regards to cavity or decay that I'm going to go over. And there's all kinds of things, but these are three, I guess, basic, kind of everyday, this is what we usually see. So we start with the idea of like a filling, a basic filling. A lot of people have heard of that and know what that is. In those cases where a filling can be used, it's where we find that 30% of the tooth structure is compromised, 30% or less, I should say. That's typically when we like to use a filling. The second thing is what we call an onlay. Onlays are kind of an older technique that have had some, I'd say, resurgence with the onset of digital technologies that allow us to do same-day dentistry. They were, I guess, challenging with regards to temporizing for a couple of weeks back in the day, and so people faded away from it. But onlays are a really good filling step up. So they're basically between a filling and a crown. When we see about 30 to 50% of the tooth structure is compromised, that's when we like to use an onlay because it allows us to conserve natural tooth structure. And then third, we get into the realm of a crown or a cap that a lot of people call it. It works like a helmet over top of the tooth. And that's when we see about 50% or more of the natural tooth structure become compromised from a cavity or decay. So those are some of the main things. Those are the three basic ones that I would say. And I have pictures for you because pictures always help. So let me show you this. This is ultimately our first one. This is where we needed a filling. So I'll get a little bit closer here. You can see, so cavity found on the tongue side of an upper molar. You can see how when we opened it up, you can really see the cavity in there. And then from there, we went through, cleaned it all the way out, and then we put a filling in there. It looks like nothing happened. That's the idea. Nice and smooth. From there, we get into the onlay. This is a lower molar, second from the back. Ultimately, you can see some decay present through there. Looks like a really deep shadow. A lot of the tooth is going to be compromised. You can kind of tell that from the get-go. Open it up, you can see it really compromises things. Gets into this cusp over here, and you can see ultimately when everything's shaped, you got about just under half the tooth really that is compromised through into there. And so then we put it back together there with an onlay. Looks like nothing happened. Nice smooth margins there, but we were able to retain a lot of this natural tooth structure on the back side, and that's our goal with that if we can. Because next step is a crown. This happens when we lose a lot of the tooth structure, over 50%, and unfortunately you have to get rid of some of the tooth structure in order to crown it, and so we have to move up to this. But you see older silver filling, very common. You find this underneath it. Some people call that, some smudge, some grossness, but there's decay too, so started there. Move forward, we start to remove it, shape it, and just look at what happens when we really pull up that filling. A lot of the tooth is compromised. Build it back up, kind of build up those areas where it's really compromised. Even have a couple of pins in there. You can see that white areas where we put a protective layer over the nerve over in this region. And then from there, we crown it. Again, really natural, good looking tooth. Sorry for the tissues looking a little iffy there. But anyways, for those of you that were wondering, hopefully that was helpful for you. But again, you got a filling, 30% or less of the tooth structure. That's when we like to use those. You get anything bigger than that, the filling probably can't really withstand it, will likely break. Then from there, where we can conserve tooth structure, not jump quite to the third or cap, we use an onlay. Greater than 30%. Less than 50% roughly, give or take. Every situation is a little bit different, and then jump to a crown when anything's greater than 50% of the natural tooth structure is compromised. So hopefully that's a little helpful for you, for those of you who are having questions about that sort of thing. If you have questions, get a hold of us. You can call us. As I said before, I really like it if people comment so that we can help out the whole group of people or the whole population that's viewing. They can hear some good answers, some good questions and answers. So if you need anything, get a hold of us. But if you like this, please share it. Hopefully we can help some other people. We appreciate you tuning in. I hope you have a great rest of your week. Thank you so much.